Hi, welcome to Love Saranghae with Peter and Andrea. In the next 30 minutes, we'll take you on a journey into the exciting world of entrepreneurship, relationships, and the secrets behind achieving that coveted glow. Are you ready? Let's go.
Welcome back to another episode of Love Saranghae with us, Peter and Andrea. Today we're tackling a topic that affects millions of people worldwide, rosacea. From understanding what it is to identifying who is more likely to have it and exploring how we can treat and reduce its symptoms, we've got a comprehensive episode for you lined up today. Whether you're someone dealing with rosacea or simply curious about this condition, this episode is for you. You ready, Peter?
I am.
All right, let's start with the basic. What is rosacea?
Yeah, so rosacea is a common skincare and long-term inflammatory skin condition. And it seems to me it's getting more and more common as we go on, because when we started the brand, rosacea wasn't nearly a topic that came up as much as I am seeing these days. And rosacea shows up as redness on your skin and skin rash, usually on the nose and cheek area. And it can get very painful for some people. I know a couple of customers who can't even touch their face because it's so painful, right? People suffering from rosacea often have very sensitive skin, and we see evidence that the skin barrier function is impaired. So something is wrong with their stratum corneum. What we don't know for sure, though, is if the damaged skin barrier is the cause of rosacea, or if rosacea causes the damage to the skin barrier. So again, that's something that researchers are taking a look at right now. Anyone can get rosacea. No matter the skin tone, no matter where you're from, no matter age or gender, anyone can get it. But you'll see a greater instance in older women, adult women, above the age of, I'm going to say about 40 to 44, like right above that, just that range, with fair complexion. Yeah, and there are different classifications of rosacea, depending on where they manifest. So the first is the facial redness with flushing. It's called neurovascular rosacea. That's probably the most common rosacea you'll see. When people say, I have rosacea, this is what they're talking about, neurovascular rosacea. The second most common is called with facial redness and pimples. It's called inflammatory rosacea. Again, probably the second most common rosacea. The third and fourth are less common. One is from the skin thickening. You see a lot of older ladies with a bulbous nose or a thickened skin. This is a type of rosacea, and it's called phthalatus rosacea, much less common. And irritated eyes called ocular rosacea. Those two rosaceas are not quite as common. So that's, in a nutshell, rosacea.
Would you say that hormones like pregnancy or menopause can affect rosacea outbursts?
Oh, that's a great question. So unlike melasma, which is known as a mask of pregnancy, there's a direct correlation of hormonal fluctuation from pregnancy to melasma. There is no evidence to suggest that rosacea is caused by them directly. What I mean by to say is that you can have a hormonal fluctuation and somebody can get rosacea from it. You can have the same hormonal fluctuation from somebody else and they won't get rosacea. So there's no direct correlation as to what a skin condition or an effect will have on the person to get rosacea in the background or not. So you can't really say it's the cause, right?
Yeah.
It's mostly genetic. We'll get into that.
Yeah, we'll get into that. So we've had a lot of, not questions, but comments with people or interactions with people where they've said, I have rosacea, and then we start talking about it, and it turns out they don't have rosacea.
Yeah.
So how would you diagnose rosacea? How would someone know that they have it or they don't have it if they haven't been to a dermatologist? What are some of the symptoms to look out for? Yeah,
that's a really good question. And the reason why people are doing that is because, and I will answer the question a little more directly, it's because there is no skin test to say that there's a rosacea. And so the most common symptom that you'll see visibly is a facial redness in the cheeks and nose. And that is really the only sign of rosacea, is a visible sign in the cheeks and nose. And it looks like blood vessels are close to the surface of the skin. And there's a word for that, actually. It's called spider veins. You see a lot of spider veining in rosacea patients. Less common, obviously, as we talked about, are thickening of the skin and eye irritation, the ocular rosacea. And there is no test or specific test for rosacea. So doctors usually go or identify based on their diagnosis on the appearance of the skin and eyes and your medical history. So a dermatologist will look at your face, they'll look at how it looks on your skin, your nose, how it comes in your eyes, and then they'll cross-reference with your medical history to say, okay, now you have rosacea. So that's the reason why many people self-diagnose, because medical professionals are doing the exact same thing. There is no other special treatment that a dermatologist will do to diagnose rosacea. Now, it is still important to go to a dermatologist. Why? Because what the doctors will do is they will probably order some tests to rule out any other potentially serious medical condition that could look like rosacea. So their job is to make sure it's not something more serious.
Like what? What would be scary?
Maybe a liver disease.
Let's guess.
Yeah, I can't really say for sure because I'm not familiar with a lot of the diseases. But for example, if you have a problem with your liver or kidney, it could come up with a skin flushing, right? So it could be a symptom of a much more insidious disease. So that's what they'll roll out first, and then rosacea. The good news is that rosacea is not it's not a disease. It is a skin condition that you have to deal with, but there is no adverse health-related effects associated with rosacea. So that's the good news.
Okay. At least that's what we know at this time. Might come
that's
out
what we
later
know.
That
Exactly.
There is some underlying gut insensitivity or something, but at this time, this is all we know. So this is what we're sharing.
It is inflammatory, so that that's a really good point.
Yeah. Okay. Well, I guess when you say medical history, do you mean that we're looking at for example, the parents and whether or not they had it?
No.
What do you mean by medical history? No,
that's a good question. So no doctor can access a medical history other than your own. But they will ask a question, did your parents have rosacea? And the answer is yes, then most likely it's rosacea because it is heavily genetically dependent. Yeah.
Okay. So what causes rosacea other than genetics? Like what are some of the triggers that could create a flare-up of rosacea?
Yeah. So like you just said, rosacea is mostly genetic, right? And we still don't know for sure what triggers rosacea in some and not in others. But because rosacea is an inflammatory skin condition, generally you're looking for causes like exposure to UV light, especially without SPF protection. That can cause a trigger. Stress, overall stress will, not just not just skin condition, right? Every stress, internally or externally, will cause some sort of inflammatory response, which can cause rosacea. Dehydration and dry skin, so basically a lessening of the thickness of the stratum corneum, can also cause rosacea because it allows for your blood vessels to be more visible on the skin surface, right? And trauma to the skin. So, I'm not talking about somebody slapping your skin. Although that could be a trigger. or you're falling on your face and scraping your skin. But things like, for example, if you suffer from acne when you're younger and you have acne scars, that is trauma to the skin. So when you're older, you tend to be more susceptible to rosacea, right?
Interesting.
Yeah. You'll also notice that people from Northern European descent, like Scandinavian countries like Finland, Sweden, Sweden, Norway, these countries have a greater instance of rosacea as well.
Is that because they are fair? They're more fair?
Yeah, that's right, because they're more fair. And genetically, for some reason, they have a greater... you could have somebody from Jamaica could have rosacea, and you can't really tell because the skin is dark. Somebody from Norway, though, you can tell right away. So, is it that you can see more rosacea, or is it that it causes more rosacea? We don't really know, but that's where the cases are coming mostly from. Now, I have to stress something here.
Okay.
I want to make sure I make this clear. I don't want anyone to go out and stop exercising or stop eating spicy foods or, forego that chocolate or whatever it is, or not go out in the sun because you're afraid of getting rosacea. You can do everything wrong and not get rosacea, and you can do everything right and still get rosacea. So, it's not something you can really prevent with simply lifestyle choices. It's a complex skin condition that, hundreds and thousands of researchers and professionals have yet to figure out the root cause. So don't stop your life. Don't stop living your life because you're afraid of rosacea. It's not worth it.
Yeah. And also, like you said, you could be doing other things right and still get it. So the important thing here is to reduce the chance of getting it by doing certain things like wearing SPF of 30 or 50 or higher, in my opinion. 50 is probably best, but a minimum of 30 SPF whenever you go outside, and it doesn't matter if it's raining or summer or winter, SPF every day. That would probably be my number one. And also, a question that came in about rosacea, she uses her gua sha.
That's right.
Is like a facial massage tool. And you need to press. There needs to be a firm pressure on it. So for someone who wasn't sure if they had rosacea, I would suggest to avoid using that tool.
Agreed.
Or any tool that would be putting more pressure on an inflamed skin.
Yeah. Yeah, so skin trauma, minor skin trauma is using a gua sha, using some kind of a physical device to irritate the skin. I know I know why the gua sha is used. She's trying to increase circulation of the blood vessels or the blood through the skin. But in rosacea, you want the opposite. You want less blood vessels showing up, right? So there you go.
All right. Well, I guess the next question would be, what are some of the most widely accepted treatments that are available right now for rosacea? What do you do if you have it?
So great. So there are a couple of clinical treatments that I know of. There must be more coming up, but they're not that popular. So we'll stay on these two. Now, because genetics plays such an important role, and we don't still fully understand the root causes, none of these treatments are 100% effective for everyone. For example, we'll get into laser a little run, but that's like the go-to treatment for rosacea. We just had a customer the other day that basically said her mom has gone through every treatment, including laser, and it hasn't helped. And I'm hearing more and more of people with rosacea where laser hasn't helped either. So again, it's a condition where not 100% treatments are not 100% effective. So you just kind of have to figure out what works for you. Many will also have side effects that can be as bad as the original condition. So you have to decide for yourself if this is worth it or not. All right. So the first one is called brimonidine or brimonidine. It's a prescription medication that is classified as a vasoconstrictor. And if anybody knows what a vasoconstrictor is, it means that it constricts your blood vessels to reduce the wellness. So there's a vasodilator. These are drugs that make your vessels dilate, right? Vasoconstrictors constrict the blood vessels. But it apparently has no effect on your spider veins.
Oh,
don't know why that would. Yeah, it's very interesting. Now, the side effect is that it can make the redness worse with itchy and irritated skin. So the reason why that happens is because, remember, any skin trauma or any inflammation can make the rosacea worse. Brimonidine, if it doesn't work, is a skin inflammator.
Oh, interesting.
Yeah, so it's going to make it worse. So you take your chances.
Yeah.
Right? You take your chances.
Is this medication or
yes,
is it topical?
I believe it is oral.
Okay.
Yeah. Laser light treatment. So pulsing lasers, but as well as a continuous stream laser. Lasers emit energy that gets absorbed by blood vessels just below the surface. This energy is converted into heat that seals the vessels, which then gets flushed out by your body. So essentially, you're basically cauterizing your blood vessels, right? Mm-hmm. So that's how it works. Side effects are, again, it can make your rosacea worse because it is an inflammatory procedure, right? So you got to take that with a grain of salt. Again, these are clinically proven treatments that have been around for almost, decades now. It has worked for some, that hasn't worked for others. So you got to make your choice.
I'll be honest, when I hear about these treatments that are clinically proven to work, but have these harsh side effects or potential side effects, I just don't want to do it. Like, those things scare me.
I agree. And I think the future...
it's almost like my recommendation would be to do everything you can outside of those treatments first. And then if that doesn't work and you're really desperate to do something, then you can experiment with these. But
yeah, I agree. And also topical before oral.
Yes, always.
Always. Ingesting always creates more side effects.
And more potential for harm. Like, there's so much more that can happen in your entire body, not just the rosacea.
Well, for those people who don't know how drugs work, when you take an oral prescription or some kind of a drug or any kind of substances in your body, your liver must first detox whatever the amount is, like alcohol, right? So your body or liver detoxes out the alcohol, but whatever's left over, what your body can't filter out, is what becomes the medicine or becomes what you feel, right? So when you take a prescription drug, your body literally tries to filter out most of it, and the rest is what affects you. So think about what your body has to go through to work out and filter all these things coming inside your body. It's not a good thing.
Not ideal if you can avoid it. If it can be avoided anyway.
I agree with you.
So then I guess my next question to you would be, what would be a safer alternative in terms of a skincare regimen for rosacea? What would you recommend our listeners try first before trying those harsher treatments?
Great. Yeah. So this is where we get to the good stuff, because we are launching a rosacea-based skincare regimen wrapped around two products that are showing extremely promising results in clinical trials by themselves. So we've combined them, and I would say we're at the cutting edge of the science of these ingredients right now. So step one, as always, cleanse properly with our double cleanser. You need to remove free radicals that can cause oxidative stress, because oxidative stress leads to inflammation. And inflammation is what causes rosacea. So always, 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 foundational cleansing is very important, no matter what skin condition you have. That's step one. Step two and three.
Can I interrupt you for a second in the cleansing step? So we have a cleansing brush that we have been gifting to all of our customers who purchase the cleanser. Would the cleansing brush be irritating to someone who had rosacea, or would it be helpful?
So that's a really good question. So the gua sha is different because you're pressing the material into your skin. So it's a lot more trauma to the skin. The brush is a little different because it's a soft thistle brush that really just kind of plays on the stratum corneum, on the outside layer. So what I would recommend is play around with it. Don't do it every day. So maybe once or twice a week, and just see how it works out. And you can always use lighter pressure versus heavier pressure. It is a great tool to clear out the excess sebum in your skin. So I would play around with it and see if it actually, if it helps versus hurts.
Okay.
For sure. Steps 2 and 3, moving on, are two products that are showing great results for rosacea currently. And they have 4 ingredients I'm going to talk about right now. The Advanced Brightening and Dark Spot Repair Serum. Long name that I named, but I will not hear the end of it from my wife, which has 25% L-ascorbic acid or 25% vitamin C concentrate with 1% tranexamic acid. Both vitamin C and tranexamic acid are showing very promising results for treating rosacea. And you can Google them right now, and they will show all kinds of research for both ingredients. The second product that we're excited about is the Advanced Pore Minimizing and Skin Cone Corrective Serum. Again, very short name, which contains 10% niacinamide, which is a vitamin B3, and 1% glutathione or glutathione, depending on who you ask.
Depending on who you ask.
We're going to stick with glutathione because it sounds better, and my mouth seems to pronounce that a little better than glutathione, whatever that is.
It sounds like a whole other product.
Yeah. Niacinamide is a form of vitamin B3 and has shown to reduce inflammation, sensitivity, and redness. So it's been a well-known go-to topical for rosacea for a long time. 10% is the highest in the market right now, so there's nothing higher they can go to. Glutathione is made from amino acids cysteine, glycine, and glutamic acid. It is now showing promising returns on treating rosacea. It's one of the newer forms of treatment that's absolutely very exciting in the world of rosacea. One thing I will note that the niacinamide serum is not an acid, right? So this particular product is not inflammatory at all. You can use it daytime, nighttime. It does not cause sensitivity to UV light. It's going to be a go-to treatment for a lot of skin conditions. So our rosacea treatment centers around these 4 excellent correctives. They're effective but safe at the same time, which is very important. Step 4, this is completely up to you. We recommend it. It's our Common Glow Snail Mucin Serum 96. No snails were harmed in the creation of our Snail Mucin 96. Okay, so
we have made triple sure on this.
Yes.
We've checked, we've researched, we've visited, we've done everything possible to ensure the safety and well-being of the snails.
yeah.
So for those people are like, no, never hitting the snail. No, we are absolutely not. And we've made triple sure of that. So rest assured, this product is fabulous. It's safe.
It's a very versatile product. It's got all kinds of antioxidants, vitamins, a few other skin-loving ingredients. But what's interesting about the snail mucin serum is that the combination of all these ingredients seems to work better than the ingredients alone by themselves. And no one can explain why. And that's the complexity of nature, right? And we call it the ultimate anti-inflammatory healing agent. The way we use our snail mucin is whatever corrective you use, whatever acid or inflammatory ingredients you use the snail mucin serum to calm it right down and seal it in. Okay? It's beautiful.
Yeah, I love it. I use it almost every day. I use it after I use the vitamin C serum.
Yeah.
And it's so hydrating and it's so nourishing. I feel like my skin is a little bit tingly after I use the vitamin C. And as soon as I put on the snail mucin,
stops it right down.
fine.
Exactly. Calms it right down. And the last step is to always finish with our oral bioactive collagen cream to lock everything in, moisturize and protect. You've got to do that because otherwise your correctives will oxidize and it will just kind of evaporate away. So you got to lock it all in.
It's a waste of money if you're not doing that final step.
Exactly. In the daytime, that's a nighttime routine, which is more comprehensive and, in my opinion, more important than your daytime routine because your healing occurs at nighttime when you sleep. In the daytime, you would add a sunscreen, at least an SPF 30, mineral-based if you have the choice. If it's a chemical sunscreen, it's okay. You can use that too. Sunscreen is better than no sunscreen at all. But if you have a choice, use mineral.
Highly recommend mineral if you have a choice. Okay, great. What, in your opinion, do you see the future outlook for rosacea treatment? What do you see in the next 5 years, for example, for rosacea treatment?
Well, I see in the next 5 years Saranghae's skincare routine dominating the world space globally.
I see that too.
I would love that. And we visualize and it shall happen. So
it's
there
on
you
my
go.
vision board.
It's on our vision board. But in all seriousness, it's going to depend on who you talk to, right? So if you talk to the clinical and the med-spa world, they will always push for acceptance of expensive and invasive procedures and treatments like maybe different types of laser treatments, etc. And you can't blame them because this is how they make their money, right? This is the world that they live in. And so they're going to keep pushing for this type of treatment.
But I would also add that it does work for some people.
It does.
So people who've had success using those treatments will 100% advocate for them.
And there is a world for it. And there's a space and time for invasive treatments like laser. But from talking to our customers, a lot of the researchers and other brands that I talk to, I think the future is all about non-invasive solutions at home based on topical and foundational skincare routines because it's much safer. And you can do this for a long period of time. Because, unfortunately, conditions like melasma, rosacea, hyperpigmentation, they're not diseases that you cure. They're skin conditions that pop up and you have to maintain it throughout your lifetime, right? So you do a laser and it lasts for 3 months, you got to go back. Is that really a solution? Right. Maybe for some it is. But I think the future is making sure that we have a routine that kind of grows with you and helps you over a lifetime.
And also taking our control back, like having the tools within a tool belt to handle these situations at home. It's not always convenient or financially possible to go and get these expensive treatments. So it's really nice to be able to know that if that should happen, I know what to do. I have a plan and I can easily access it when I need it.
Yeah, that's right. And it's obvious why this is the direction that Saranghae, where we're headed. Ingredients like tranexamic acid and glutathione are not that common right now, but they are. More brands are starting to discover these ingredients And, we've incorporated them very early on because, we think we're at the cutting edge of the ingredients world. So this is where we're headed. This is where we're going.
It's exciting. It's exciting to be able to come up with solutions for these problems that have bothered people for years. It's been decades-long skin conditions that not a lot of companies have been able to solve. And we're solving those problems, and I think it's really cool.
And hopefully, as we move forward through the years, there will be new innovations, new solutions that you want to try out. But for right now, what we're offering in these 4 ingredients is at the cutting edge of research at the moment.
Amazing. Well, that's our episode today. We hope you found the discussion on rosacea informative and helpful. Remember, managing rosacea is all about understanding the triggers, finding the right treatments, and maintaining a gentle skincare routine. If you enjoyed this episode, please let us know. We love to hear your thoughts. And if there are other topics that you would like us to address on the podcast, also let us know. We love to hear from you. Thanks so much for listening. We'll chat soon.
Thank you. Bye-bye.
Bye. Thanks for listening to Love Saranghae with us, Peter and Andrea. If you've enjoyed this episode, leave us a review. Your ratings and reviews help more people like you find our show. Don't forget to subscribe so you never miss an episode, and share this podcast with someone you think would love it. Until next time, love yourself, love one another, and love the world.